Okay. My presentation about features of blood supply to the brain and syndrome of damage to the brain of anterior cerebral artery and middle and posterior. Next, artery supplies the brain. The most common artery, anterior cerebral artery, and middle and posterior. Next. Features of blood supply to the brain. Cerebral circulation is the movement of blood through the network of cerebral artery and vein supply the brain. Artery deliver oxygenated blood, glucose, and other nutrients to the brain. Blood supply to the brain is normally divided into anterior and posterior segments relating to the different arteries that supply to the brain. The two main pairs of the arteries are the internal carotid artery supply the anterior brain, and the vertebral artery supply the brainstem and the posterior brain. Next. The anterior cerebral circulation is the blood supply to the anterior portion of the brain, include eyes. It's supplied by the following arteries. Internal carotid artery. These large arteries are the medial branch of the common carotid artery, which enters the skull as opposite to the external carotid branches which supply the facial tissues. The internal carotid artery branches into the anterior cerebral artery and continues to form the middle cerebral artery and anterior cerebral artery. After that, anterior communicating artery connect both anterior cerebral artery within the floor of cerebral villi, and we have middle cerebral artery. Next, the posterior cerebral circulation, the blood supply to the posterior portion of the brain includes the occipital lobes and cerebellum and the brainstem. It's supplied by the following artery. Vertebral artery, this smaller artery branch from the subclavian artery, which primarily supplies the shoulder, lateral chest, and arm. Within the cranium, the two vertebral artery fascia into the basilar artery. Basilar artery supplies the midbrain cerebellum and usually branches to posterior cerebral artery. And we have posterior cerebral artery and posterior communicating artery. Next. We have syndrome of the damage to the brains of the anterior cerebral artery. Anterior cerebral artery syndrome is the condition whereby the blood supply from the anterior cerebral artery is restricted and leading to the reduction of the function to the portion of the brain supplied by that vessel. The medial aspect of the frontal and parietal lobes, cerebral ganglia, and the anterior frontis and anterior corpus calcium. Signs and symptoms: it's hemiparesis or hemiplegia. Contralaterally, it's involving primarily the lower limbs and pelvic floor musculature. Sensory deficits, contralaterally involving primarily the leg and perineum. Apraxia due to branches to the sublunary motor area and the corpus callosum. Next. syndrome of damage to the brain of the middle cerebral artery. Middle cerebral artery syndrome is a condition whereby the blood supply from the middle cerebral artery it's restricted and leading to reduction of the function of the portion of the brain supplied by that vessel. The, the, the lateral aspect of the frontal and temporal and parietal lobes, the corona radiata and globus pallidus and caudate and vitamin. The medial cerebral artery is the most common site for the occurrence of ischemic stroke. Signs and symptoms: hemiparesis or hemiplegia of the lower half of the contralateral phase and hemiparesis or hemiplegia of the contralateral upper and lower extremities. Of the extremity and speech impairments or aphasia. It's Broca's area or Wernicke's or global aphasia as a result of the hemisphere lesion. It's usually in the left brain. Next, syndrome of the damage to the posterior cerebral whereby the blood supply from the posterior cerebral artery is restricted and leading to the reduction of function of the operation of the brain supplied by the vessels, the occipital lobe, the inframedial temporal lobe, and large portion of the thalamus and the upper brainstem and midbrain. Signs and symptoms: peripheral territory lesion, it's contralateral homonyms and hemanopsia It's central territory lesion, it's central post-stroke thalamic pain, it's spontaneous pain and tisias and sensory impairments. Next. Thank you for attention.